Every day, millions of people live unaware of a silent threat to their bodies. It's not HIV, it's not malaria, it's hepatitis. It's a disease that claims over 1 million lives every year, and often without warning. So today we're diving deep into what hepatitis really is, how it spreads, and why now more than ever it matters, especially in Nigeria. Okay, so welcome to my channel. My name is Dr. Adeniran Timothy. I want to be making videos where I could discuss health-related information and other health topics, particularly concerning hepatitis. And in today's video, we're going to be breaking down the basics of hepatitis and doing an introduction to it essentially, and what exactly you can do about it as a viewer. Okay, did you know that Nigeria has one of the highest rates of hepatitis B and C in the world? Crazy, right? And we're going to be learning why exactly is that in this video and what you could do about it. So first, starting with what exactly is hepatitis. Hepatitis is a word from two words, hepa and itis. Hepa talking about the liver and itis talking about inflammation. So together it's an inflammation of the liver. So that is a noxious injury to the liver, and it can occur as a result of toxins. It can result from infections, viruses, radiation. But in today's video we're specifically talking about the virus aspect of hepatitis, and the moment this liver is affected, the effects are reduced or weakened, and so that poses a threat or a danger to the entire human body system. There are 5 main types of hepatitis, particularly the hepatotropic hepatitis virus. That is what I'm talking about right now. And we have hepatitis A, B, C, D, and E. Hepatitis A and E actually are spread through the fecal-oral route from infected hosts practicing poor hygiene to an uninfected host, while hepatitis B, C, D are usually spread from an infected person through sexual contact, blood-borne products like blood transfusion, plasma transfusion, and the others, and also through sharing of sharp objects and needles, particularly in patients or in individuals that are drug users that share needles, those kind of people, or doctors or other paramedic officers that have a needle prick while on duty. Also importantly to note is the mother to child transmission, just similar to what HIV is. In Nigeria particularly, we'd like to talk about some of the ways in which hepatitis is spread. Blood transfusions that are done without proper screening, mother to child transmission, maybe the mother isn't even aware or not properly treated, sharing of sharp or unsafe objects. You're using one blade to circumcise a lot of children in the community, the same blade for different people to barb or cut their hairs. These are some of the practices in Nigeria, tribal markings and all those things. These are some of the reasons why in Nigeria there seems to be a large amount of hepatitis B and C, particularly in the populace. So other risk factors could actually include multiple sexual partners, sharing razor blades, getting tattoos in unregulated places, some things that have to do with exposure to the body fluid, blood, or whatsoever. We also spoke about the health workers that are also at a risk already. Do any of these risk factors seem familiar to you? Have you heard or seen people practicing these kind of things? These are some of the reasons why there is an exposure to hepatitis B. We're going to be talking about signs and symptoms now. So here's the tricky part. Many people do not know, or they don't even feel sick. That's the thing about hepatitis. It's not so straightforward in the early stages to know that one has hepatitis. However, once symptoms of yellowness of the eyes, that's jaundice, weakness that is continuous, there's nausea, loss of appetite, there's a pain in the right upper quadrant of the abdomen, we begin to go into the territory of disease progression, alright? And one of the ways to actually confirm if this is hepatitis is a simple blood test. We determine the markers of the hepatitis B or hepatitis C virus in the blood, so we can screen for certain antigens on the hepatitis virus or the body's reaction, so we can look for antibodies that we can produce against these viruses. So there are other different types of investigation to determine the type, the progression of the disease, the severity of the disease, and whatnot. So this is just an intro video, but we'd like to tell you also how you can prevent it, alright? Ensuring that blood products before transfusion are properly screened, using condoms during sexual intercourse, avoid sharing sharp objects or reusing needles between one individual and another, and very, very importantly, vaccination, particularly for individuals that have not been infected with hepatitis B. If an individual is infected, so what exactly is the issue? Yes, there are various things that could happen, but I would like you to know the positives first. Hepatitis C, for example, can actually be cured, while hepatitis B currently doesn't have a cure, but it can actually be managed lifelong, similar to the retroviral disease. And just a little light on what Nigeria is doing through the National Strategic Framework on Hepatitis Elimination. So there's a public health threat that Nigeria wants to eliminate hepatitis B by 2030. And part of the things they're doing is to expand free testing. They're promoting vaccination programs and educating communities, like what I'm doing in this video. But to win this fight, we need to play our part. We need to play our part. So share this video with someone who needs to hear about it. Get tested yourself, get vaccinated if you need to. Together we actually can, beat hepatitis in a major way and save lives across Nigeria and beyond. So thank you for watching my first video. I'd like to see you in the next one. Ciao.